Hello students, my name is Manimugdha Medhi, Assistant Professor in Social Work Program, Humanities and Social Sciences, Assam Downtown University. In our last class, we have discussed about the changing perspectives and trends in psychiatric social work. In today's video, we will discuss about the Indian view of mental health awareness and well-being. Okay, so so let's see what is there in this unit. So the mental health is basically a very major concern, right? Both worldwide and in India. So developments in the field of mental health has actually been very slow, due to which Dr. Brock Chisholm, the first Director General of World Health Organization (WHO) in 1954, had declared that without mental health there can be no true physical health. So even after 65 years, the scenario has not altered substantially, and about 14% of the global burden of disease is attributed to neuropsychiatric disorders. The burden of mental disorders is likely to have been underestimated because of inadequate appreciation of interplay between mental illness and other health disorders. These remain considerable issues of priority setting based on the burden of health problems and of addressing inequalities in the relation to determinants and solutions for health problems. Progress in mental health service delivery has been actually very slow in most of the low and middle income countries. Barriers include the existing public health priorities and its influences on funding, challenges to delivery of mental health care in primary care settings, a low number of those trained in mental health care, lack of mental health perspective, and public health leadership, right? So it has become, it becomes now opportune to explore the paradigm of mental health awareness as a means of combating stigma, enhancing prevention, ensuring early recognition, and also stimulating simple and practical interventions within the community. Today, there are opportunities in terms of growing acknowledgement of mental disorders as key targets of global health action, as well as of leveraging new technologies, particularly internet, big data, and cell phones, in amplifying simple field interventions found successful in primary care and other prospects. So basically, it says how mental health awareness has become so much important in fighting with various stigma and prevention of the mental disorders early, making sure that it has been recognized early or diagnosed early, and and simple and practical interventions within the client or group or the community. So mental health awareness, it is basically about awareness of mental health, right? And the word itself says mental health awareness basically is the awareness of our mental health. So these campaigns of mental health awareness have basically yielded positive outcomes, and some of the strategies undertaken to target awareness and address stigma around mental illness include participation by family members, sensitization to treatment and social inclusion. Lack of knowledge about the mental illness poses a challenge to the mental health care delivery system. So basically sensitizing the family members and the community at large becomes so much important about mental health, right? If people does not know about the mental health, then how they will know that they are, something is wrong. So recent research has highlighted that the role of community-based systems in low-income countries has also yielded various positive results in creating awareness and thereby impacting the participation of people. In Indian scenario, mental disorders were in pre-ancient age or in Vedic ages, mental disorders were mentioned in Ayurveda, Unani, and Siddha. So in that stage, we have already studied the history. There's there were three stages of understanding. That is, at first it was known as the mental illness was caused due to sin, or it was caused due to supernatural factors, or demonology or black magic. So those were how mental illness was caused. But slowly in the 1800s, we came to know we came to know about a lot of psychologists and psychiatrists who Sigmund Freud, who was a father of psychoanalysis, introduced the concept of psychoanalysis and psychosexual development, right? And slowly now it has come to community psychiatry, where we, mental health awareness needed to be provided to the whole community or the society. In the ancient times and in the medieval times, institutionalization of mentally ill in India has been recognized by King Ashoka, who was who gave concentration on mental health, who gave actually a great importance on mental health. In those times, he used to make asylums, similar to asylums or hospitals which have a lot of beds, and where care and prayer and care were provided during his reign for the mentally ill patients. Again, in the medieval period, the Delhi Sultanate, Mughal Empire, and later the Britishers also started various asylums where mentally ill patients were kept. This was basically, were given basically to the soldiers who were fighting for, who were fighting wars for all these empires, and because they also tend to get depressed with all those killings and shouting and guns and everything, right? So it becomes very they become very much prone to mental disorders or depression or anxiety. So all these things. So they were provided asylums or institutions. In the Indian scenario, however, after the Britishers left, basically, it has been a bit different. As we have studied in the history, that in 1936, Tata Institute of Social Science came into being, and it has introduced various fields in social work practice. And later, in 2000, in the late 2000s, we have WHO has defined sustainable development goals and elaborated the impact of mental illnesses and suicide on them. So suicide has become a very major trend these days, right? And we are all hearing about suicide case here or there. Even celebrities are doing suicides. So the suicide rate in India in 2015 was 15.7 out of 1 lakh people. Okay, and now it is on the rise actually. It is basically higher than the regional average, that is the Asian average of 12.9 and the global average of 10.6. So Indian suicide rates is considerably very high. Suicide is the leading cause of death among those aged 15 to 29 in India, and this remains a massive unaddressed need with the population even in 2020. Despite improvements in various health indicators, India contributes disproportionately in the global burden of disease. Our health indicators compare unfavorably with other middle-income countries and India's regional neighbors like China or Nepal or Bangladesh. A large portion of the population ends up impoverished because of high out-of-the-pocket healthcare expenditures and suffers the adverse consequences of poor quality of care. Task shifting to non-specialist community health workers has been recommended as an effective strategy for delivery of efficacious treatments in low-resource settings. So this has been a kind of a positive trend these days, but still lots of work needs to be done. Given a dire shortage in numbers of psychiatrists, psychologists, psychiatric nurses, and social workers, for that matter, piggybacking on primary care systems and employing innovative force multipliers are the future courses of action. So we actually have a very less psychiatrists or social workers or psychologists working in the mental health field, right? So that is why it becomes so much important to take innovative force multiplying options, so that more and more people come to learn psychiatry or psychology or psychiatric social work or even psychiatric nursing. So what is the roadmap for mental health awareness? For the large Indian population to be involved in its own mental health, the only way forward is through enhancing mental health awareness, which will generate its own demand. With rising awareness, it can be expected that early recognition and access to treatment will follow, as will the adoption of preventive measures. It can also be expected that with enlarging awareness in a democratic society, or advocacy or leveraging of political will, funding, and cross synergies shall follow. Okay, so this is basically a very simple roadmap, enlarging awareness in a democratic society like India, where advocacy can be done, or political will or funding can also be done simultaneously along with awareness. So conventional media is one which helps providing a big amount of awareness actually on mental health. Media has been the cornerstone of previous action in the field of mental health awareness. And several celebrity endorsements were done in recent times who shared their experiences of depression together with taglines of advertisement and content-rich narrations and documentaries, right? So, recently so many celebrities have come out, for, like for example, Me Too campaign was done, right? For the rape, to come out, stories with rape victims, right? Then recent suicides have also caused several celebrities to endorse, mental health awareness, right? Depression or anxiety. Making evidence-based mental health information easily available to the journalists and other content providers like internet portals from trusted and reliable sources like Indian Psychiatry Society, research organizations, medical colleges, etc. through their websites is a relatively very simple step, and a lot of mental health information can be provided there. Accessibility of simply translated jargon-free content in various regional languages in written and spoken forms will go a long way, right? If it is accessed in a simple way or translated in the mother tongues of the various regional, languages, so then the awareness will go in a more phased manner. It also behooves professionals in the mental health domain to take the lead in engaging and partnering with the media, and encouraging recovered patients to make the success stories accessible to all shall make good and positive authentic narratives. Next one is the government programs, where we generally see governments doing a lot of missions and programs. Sorry for that. Despite some cavilling about the quantum, the government remains the biggest single spender in the mental health sector, right? While most new interventions remain isolated and confined to the urban areas, it is only the public health system through large programs which can reach the rural masses, right? So apart from national and district mental health programs, the National Rural Health Mission is on its way to becoming the vehicle for delivering mental health as a part of integrated primary care at the cutting edge of the public healthcare system. Seeing that, it partners with existing private and alternative care providers in a non-threatening manner and shall help large interventions synergize and succeed. So government programs will really help out, with if the proper implementation is done, and there is no corruption and all. So it can actually reach the rural masses, more than even the NGOs and people. So next is the education system and industry. So the most chronic and debilitating mental illness have their onset before 24 years. Okay, most of the mental disorders come during the age of 20, 21, 18. Okay, and mostly before 24. So those basically are the part of education system, right? Those are students. From including mental health narratives in curriculum and destigmatization, removing discrimination and early detection to empower stakeholders for early detection and simple interventions, the educational system yields a lot of opportunities for enhancing mental health awareness. So if the education institution can give curriculum about mental health processes, or to mental health counseling, so it can be very much important for students to identify or if there is any mental disorder, or it can be detected early, right? And it can also, simple interventions can also be given. So in that way, mental health awareness is provided. Then in industry, the organized sector suffers significant loss of effective workforce through mental ill health, right? So, not only as a part of corporate social responsibility, but also to maintain productivity, it becomes so important to engage with mental health awareness in a concerted fashion. So even for industries, it becomes important through corporate social responsibility. It becomes a bit easy to provide mental health awareness to various villages or rural areas. But also with the aim of maintaining high productivity, the organizations and industries should take safe actions to conduct mental health awareness. Next is the internet, social media, and cell phones. Nowadays you get so many informations regarding mental health and physical health, right? So for mental health, some are trustworthy, some are not. But even though you get the information, right? So handheld devices and social media can truly be game changers if the actual information is provided in the propagation of effective mental health interventions through focused amplification and not just in increasing information, right? So focused amplification is very much required. With a greater utilization of big data, the understanding of subtle and distributed patterns over large volumes shall inform decision making. So through internet, if one can provide awareness or learning, so mass population will know about mental health awareness, which is very much important in today's scenario. Next is the crowdsourcing, where the ultimate convergence of information technology is a free society results in crowdsourcing, which breaks down barriers of geography, historical inequalities, and economies of scale. So crowdfunding or crowdsourcing is a very successful model in testing radical ideas which flounder outside the mainstream. So if you do crowdfunding, then more and more mental health awareness will be provided. Dynamic ideas of individuals can also synergize with the success stories of NGOs to amplify them across geographies and time. So even NGOs can help in crowdsourcing and crowdfunding. Okay, where a maximum number of mental health awareness is provided. So in conclusion, considering that most of the earlier strategies to enhance mental health have not succeeded over the past 6 decades or more in less developed countries, the time has come to take on new approaches, right, with renewed vigor. Mental health awareness can become both means and a way of ending this apathy. And progressive government policies based on evidence-based approaches and engaged media, a vibrant educational system, a responsive industry, aggressive utilization of newer technologies, and creative crowdsourcing, might together help dispel the blight of mental illness. So, with the help of media, with the help of industry-based social responsibilities, with the help of proper curriculum in the educational system, with the help of proper digital means or social media platforms, and crowdsourcing, we can basically provide and not to forget the government policies or acts or legislations or missions and programs which can actually go deep into the rural based and tribal based societies where maximum number of mental health cases are there and maximum number of mental health awareness can be provided, right? So with these things we have actually we can give more mental health awareness to people and to the community and society. So this is all for the first unit till date, and I hope you have understood some of the concepts, and hope that you have taken the notes, and we will discuss more about them or about all the units in the classes, and you can also ask various amount of doubts, and you can ask questions as well. So please be please also read the notes provided to you in our portal, and make use of all the video links or YouTube channels or additional notes which we have provided, and please come up with various kind of questions, and not to fear about the corona pandemic, and because the learning never stops, right? So please go through all the materials provided to you and be ready for your future. Okay, we'll see you in our next videos, and until then, see you. Thank you for listening.